At some point in our life, we could all get them, cataracts. They're a natural part of aging that will ultimately impair our vision and can affect our quality of life. Today's guest will help us see more clearly, pun intended. Meet eye surgeon Dr. Cathleen McCabe and Sharon Ulysses, a cataract surgery patient. Welcome to the show, ladies.
Thanks for having me.
It's so great to have you here today. And June is Cataract Awareness Month, so it's perfect that we're discussing this. Let's start with what is a cataract and what causes them.
So the cataract is your natural lens of the eye, and it sits right behind your iris, the colored part. And when we're born, it's nice and clear like this, and light can come through and focus on the retina, and you see clearly. But as time passes, it becomes more and more like this, which is cloudy and yellow, and light has a hard time getting through, and you don't see clearly. And there are many things that cause cataracts too, like trauma, certain disease processes like diabetes or drugs like steroids can make them happen earlier in your life. But everybody develops a cataract because it is the natural aging process of the lens in your eye.
What are some early signs that you might be getting a cataract, if I were looking for something?
Cataracts cause you to have fuzzy vision, and so a lot of times patients just think they need new glasses. But it'll also cause glare and halos, so if you're driving at night and you see those big lights around headlights and have a difficult time seeing street signs, for instance, that oftentimes is cataracts. It changes your color perception. Blues and blacks are harder to tell apart. And it can make it harder for you to see things like a golf ball in the air, for instance.
Really? I mean, like it kind of just disappears? You don't know where it's gone?
That bright sky just washes everything out when the light gets scattered by your cataract.
And that's when we need to see a doctor, right?
Exactly. That's the first step, actually, is to see your doctor for a comprehensive eye exam. And that's usually when patients first find out they have a cataract.
Now, Sharon, you had cataracts in both eyes, right?
Correct.
When did you first notice that something was off with your vision?
I can't really say you can first notice it. It's silent and it's very slow growing, and plus people of my age often say, well, I can't see as well, it's just my age.
Right.
But because of Dr. McCabe telling me that I had a cataract, as Dr. McCabe explained, it's cloudy. It's like looking through a steamed up shower door.
Wow, right.
The lights are very hard on your eyes. Depth perception was bad. So if I was going down steps, I would hang on and slow everybody up because I wasn't sure the step was there.
Right.
And driving at night, I just literally stopped driving at night. The glare of the lights hurt too bad. And as Dr. McCabe explained, there's halos around the oncoming traffic, and it was like if something came out in front of you, you wouldn't be able to see it because your vision is that bad.
And then you had surgery.
Oh, yes. I had surgery, and I could not believe. You have to go to the office very early the next day, and we were about an hour and a half from the office. So when we left, it was dark. And as we were going down, the sun started to come up, and I just started to cry. It's very hard to talk about. And my husband said, "What is the matter?" I said, "I can see." It was absolutely a miracle. You thank God, you thank everybody, and it's just amazing because I could see like I was 6 years old. I mean, the clarity. I said, there are colors. There are, definition to things. It's just amazing. The difference is mind-blowing.
And I mean, how rewarding for you to hear that.
I truly have the best job in the world, really. It's a pleasure that we can do something for something that's not, it impacts people's lives in a way that sneaks up on them. But when we fix cataracts, when we take cataracts out surgically, which is the only way to treat a cataract.
And I want to stop you there because some people think they're eye drops or medications.
Yeah, there really isn't anything else that will make them go away except for taking them out. Now, luckily, that's curative. Once we've removed a cataract, it never comes back again. And we can actually put a lot of what was your glasses prescription in the prescription of the implant that we put in at the time of cataract surgery.
That is great.
We can often make you see better than you've ever seen before without glasses, which is really what a privilege for me to be able to do that too.
Absolutely. Doctor, can you explain astigmatism? And if you have it, can you still undergo cataract surgery?
One of the exciting things about cataract surgery today is that we can also address astigmatism. And what astigmatism is it's the curvature of the cornea. So the cornea is this clear window on the front of the eye. and it has a curvature. And if the curvature in every direction matches, you don't have any astigmatism. But in most patients, the curvature is different. It's steeper in one direction than another. And that will make a fuzzy image unless it's corrected. And it's corrected with glasses, but at the time of cataract surgery, we can actually do that correction in the eye with a special kind of an implant so that your astigmatism's also corrected and you can see better without glasses potentially.
Doctor, where can we go for more information?
You can go to the website, myeyes.com/cataracts, sponsored by Alcon.
Yes, fantastic. And you can also visit our website, thebalancingact.com. Thank you, ladies, for joining us. Great show today.
Thank you.